The information provided in this video is for educational purposes only and is not intended as medical advice. Please consult with a healthcare professional for medical advice, diagnosis, or treatment. Hello everyone, welcome back to my channel. I'm Dr. Shalok Manjal, and today we are going to discuss a very important topic of intellectual disorder. We'll cover its definition, core deficits, epidemiology, pathogenesis, evaluation, and both non-pharmacologic and pharmacological treatments. Additionally, we'll highlight some specific supports available in New York State. Let's dive right in. Intellectual disorder, also known as intellectual disability, is a neurodevelopmental condition characterized by significant limitations in both intellectual functioning and adaptive behavior. These limitations manifest before the age of 18 and affect everyday social and practical skills. The core deficits of intellectual disorder include intellectual functioning decline, such as challenges in reasoning, problem solving, planning, abstract thinking, judgment, academic learning, and learning from experience. Also, there's a decline in adaptive behavior, where there's difficulties in conceptual skills like language, reading, writing, math, social skills like empathy, social judgment, and communication, and practical skills like personal care, personal responsibilities, job responsibilities, and money management. To differentiate between intellectual and adaptive behavior, it's extremely crucial to think about what skills are getting affected. For intellectual functioning, this refers to the cognitive abilities such as learning, reasoning, problem solving, and abstract thinking. It's often measured using IQ tests. As for the adaptive behavior, this involves practical, everyday skills that are needed to live independently and interact with the environment and people socially. It includes conceptual skills like language and math, social skills like communication and empathy, practical skills like personal care and job responsibilities. Adaptive behavior is how a person uses that IQ to intellectually relate with real life situations with people and environments. As for the epidemiology, intellectual disorder affects 1 to 3% of global population, and it's more common in males than in females. The causes of intellectual disability can be both genetic and non-genetic. For genetic factors, they can be linked with Down syndrome, Fragile X syndrome, Prader-Willi syndrome, and others. Non-genetic factors can include prenatal exposure to infections, toxins, malnutrition, complications during birth, such as hypoxia, and postnatal factors like traumatic brain injury or severe infections. The evaluation of intellectual disorder involves testing the IQ, which is the intellectual functioning. It also tests adaptive behaviors using Vineland adaptive behavior scales and others. It is also extremely important to identify underlying causes and associated medical and genetic conditions that could be interplaying with this. The non-pharmacological treatment includes special education like tailored education programs to meet individual needs, behavior therapy, techniques to improve adaptive behaviors and reduce challenging behaviors, speech and occupational therapy to enhance communication and daily living skills, family support for counseling and support system of families to help them cope and provide better care. There are some specific supports that are specific for New York State. For example, OLV, which is Our Lady Victory Human Services RTF, Residential Treatment Facility. Other residential treatment facilities, Office for People with Developmental Disabilities, also called OPWDD, which gives services for disabled individuals, intellectually disabled, physically disabled, and others. People Inc. is another institution that offers wide range of services for individuals with intellectual and developmental disabilities, including residential, employment, and community-based services. Importantly, there are pharmacological treatments that can be used to mitigate some of the symptoms. If the person is having very behavioral issues or aggression issues, antipsychotics can be used. If they're mood disorders, then you can also use antidepressants and mood stabilizers. If you have ADHD symptoms with impulsivity, hyperactivity, even oppositionality, stimulants can be used. And anticonvulsants can also be used for individuals who have co-occurring epilepsy and mood symptoms. To conclude, it's extremely crucial to understand intellectual disability and provide appropriate care and support to those affected. Early diagnosis and intervention can significantly improve outcomes. Thank you for watching, and don't forget to like, share, and subscribe for more videos.